Down to single digits. Today, the state health department reported there were only 7 ICU beds available in the entire Austin area as COVID-19 surges.
But this Omicron-fueled spike is also being complicated by staffing issues. Mike Marute joins us now live from our newsroom to explain more about that tonight. Hi, Mike.
Hi, Quita. Hi, Brian. We've seen local hospitals get down to having very few ICU beds available during previous surges in this pandemic. That's not new. But local officials say staffing issues mean hospitals just don't have as many beds available to begin with. So let's look at the numbers. Right now, 178 COVID patients are in ICUs in the Austin area. That's still far below the records we set for ICU use during the Delta surge. But here you can see how few ICU beds are open in our area. This number can change from hour to hour, but at one point today, just 7 beds were available across the whole region for a population of 2.4 million people. And more children are ending up in hospitals with COVID now, 486 in hospitals statewide. Pediatricians say while most children don't see severe effects from this virus, this spike is still a pretty big concern.
The percent of children who end up in the hospital is not changing a whole lot. It thankfully is still a very small percentage. But the problem is that when the number of kids who get COVID goes up so much, a small percentage of a much larger number is a much larger number. And that's going to lead to our hospitals being very full.
Doctors also say many kids who are hospitalized for COVID end up dealing with other respiratory illnesses like flu or RSV at the same time. So Brian and Quita, at one point today, local hospitals had 36 patients being held in emergency rooms waiting for ICU beds. So some people who need that intensive care are now having to wait for it.
Tough to hear that. KVUE's Mike Marute live in the newsroom tonight. Thanks, Mike.